One of the things we do here at our office is we screen every one of our patients for a sleep disorder breathing problem. And what that screener tells us is if they are at risk for having breathing problems at night. The screener asks a few questions, and some of the questions are, do you snore? Has anyone told you stop breathing at night? Do you wake yourself up at night gasping for air? Do you feel like your heart rate is increasing at night? We also ask questions about sleepiness. Do you have daytime sleepiness? Do you fall asleep at a stoplight? Do you fall asleep while you're watching TV? All those things let us know that you might not be fully rested and you might not be getting the right amount of sleep every night. One of the problems is obstructive sleep apnea. Basically, when we stop breathing at night for periods of time. Very dangerous situation. People die 15 years earlier on average if they have untreated obstructive sleep apnea. So when people get diagnosed with obstructive sleep apnea by a physician or by a pulmonologist, they are usually prescribed a CPAP. A CPAP is basically a fighter jet mask that's pumping air into your lungs to keep your airway open. Nobody wants to wear that if they don't have to. And the American Association of Sleep Medicine recommends an oral appliance as opposed to a CPAP for mild or moderate sleep apnea, as well as people that have severe sleep apnea that can't tolerate a CPAP or just refuses to wear a CPAP. What we provide is what's called a mandibular advancement appliance. It is basically a night guard that holds the lower jaw forward and keeps the airway open. Obstructive sleep apnea occurs that when we fall asleep, when we hit REM sleep, our muscles go into an atonic state and everything drops back and closes the airway. This appliance keeps your lower jaw forward, keeps the airway open. 75% of people who snore have some form of obstructive sleep apnea. So the immediate benefits patients receive is they quit snoring. There are bed partner benefits because of the lack of snoring. They wake up with less daytime sleepiness and they feel much more refreshed.